into your first therapy session, it's important to remember that it can be an emotional and perhaps a bit awkward experience because you're going to be opening up and telling your personal problems to someone that you hardly know. So it's completely normal to feel a little bit of discomfort, and there are ways that you can prepare for this. So the first thing that your therapist is going to ask you is, why therapy now? So before the session, it would really benefit you to sit and reflect upon what it is you're struggling with and what you would like help with. Try to be as specific as possible. Don't just say, I have a lot of anxiety. Maybe think to yourself, I'm in relationships, I keep repeating the same unhealthy patterns, or I'm procrastinating at work. For some reason, I know I can do it, but I can't get my work done. Well, you may want a therapist who is warm and validating, or you may really need somebody to push you and hold you accountable. Stating these things up front will really help the effectiveness of the work that you do together. Also, it's just important that you think of what you would like to achieve and make sure you tell that to the therapist so they know how to help you. Therapy is not just for people who are suffering with serious psychological problems or mental issues. Everyone, no matter what you're going through, can benefit from reflecting on their life and going to therapy to really talk through your issues. The therapy that a lot of people practice, cognitive behavioral therapy, targets your thoughts. It looks at how the thoughts you have can tend to be overly negative, not consistent with reality, and generally unhelpful, and how these thoughts may hold you back from really achieving what you want or living a fulfilling life. For example, a lot of times we all tend to really focus on our failures and fixate on that. And then when we do achieve or when we do meet expectations in life, we sort of filter those experiences out and we don't let them into our perception. So we're not seeing a full balanced picture of our life. And if we just see ourselves in this negative way, we're going to anticipate that other people will see us that way. And our perception of the world just will be, in general, negatively skewed. And so it's very important that for any person to develop a really well-balanced and realistically based way of seeing the world. So my title as psychologist differs from other therapists because I hold a doctorate degree rather than a master's degree. So I've gone to school for a little bit longer. I've also been trained to do psychological testing for diagnostic purposes, which can include cognitive testing and personality testing, which therapists who have just gotten their master's degree are not qualified to do. Yes, so HIPAA laws ensure that everything between you and I as the psychologist will stay completely confidential with a few exceptions. So for example, here at Radish, I work with a team of medical doctors to consult with on your case. So let's say I need to really understand what's going on with your panic attacks and I think there might be a physical explanation. I will then talk to the doctor about that, just so we're giving you the most complete care. Another way that we may have to break confidentiality is if you seem to be a harm to yourself or to others. So if a person has suicidal ideation or homicidal ideation, then we may have to report that. If you go into therapy, you absolutely don't have to take medication. In fact, we'll first try to see if therapy alone will help alleviate your symptoms. Now, this usually works for a lot of people, but for some, the symptoms will remain and they will feel so emotionally overwhelmed that it's difficult to tolerate therapy or to function at a high level outside of therapy. In that case, we would refer you to the psychiatrist to see if medication would work. Well, in an ideal world, there is something very special about being in the same room as your therapist and being able to interact that way and take into account body language and like the energy that the patient is giving off. But I've found in my practice that it's not necessary. In fact, a lot of my patients have switched over to telehealth because it's so convenient and they can talk to me in the comfort of their own home where they feel like they can just let it all hang out. And so I do feel, for that reason, that it is as successful as seeing people in person, and the attendance is a lot better because there's no excuse not to come to therapy when it's virtual. Thank you so much for all the questions. If you feel like you could benefit from therapy or talking to somebody, I would love to schedule a session with you, and you can book it through the Radish app. I really hope to talk soon.